Again, good evening, everyone. Thanks for joining us this afternoon. As Ms. Vale said, Ms. Chavaria, I'm the Chief Information Officer here at Social Security Board. I'll give a brief overview of the project we've undertaken for the last few years to automate Social Security's core processes. Those core processes include registration. Obviously, we have the registration, our beneficiaries and employers, people we call, and other people that interact with Social Security. We also have to manage the interaction of our employers who collect contributions, which is important in funding the various benefits that Social Security provides, and also obviously deliver benefits to our beneficiaries. So the core platform consists of these technology components that we have here. And so I'll through them. Basically, the core technical components consist of Microsoft Dynamics, which is a CRM platform, a customer relationship management platform. Office 365. I think most people on this call would be familiar with Office 365, which includes your Outlook, Word, and so on and so forth. Fulcrum Biometrics provides us the technical capabilities to collect and manage biometrics. Right now, we only collect fingerprints. And then Azure is our cloud-based infrastructure that allows us to host the portals and other interfaces, especially the interactions we have with banks and other partners. We also use Power BI and Microsoft AI for reporting, just at the beginning right now, but that would allow us to have insight into the information that we collect and so that we can serve you better. And then for integration and data storage and data management, we use the Microsoft integration platforms, including SQL Server and a tool called Kingsway Soft. Those are the main technical components. But to serve you, if you notice, we have from left to right, we have the various capabilities that you use, right? So security, branch management, people are familiar with take a number and so on. They come into the branch, or insured persons for registration and so on, employers doing registration and changing their information. Benefits, those are the core processes, as I said, right? And then on the left for the right for document management and collaboration, we use the Office 365. So when you upload documents like your the paper that we use for medical certificates and so on right now, that's managed through Office 365, as I said before. For biometrics and fingerprinting, we use Fulcrum Biometrics, which is an international company. And then all the various portals. So we have the IP portal that most everybody should sign up for. That's the portal, that's the main portal. And then the employer portal that our employers use to interact with Social Security. And then we'll be introducing to you very shortly, and which will be demonstrated by Justin later on in this webinar, the medical provider portal. And so that's basically the key areas. Just to see in terms of the access that you have, right? As I said, you have registration, which would be done through the IP portal. Employer portal supports people that submit statements and so on, all the employers to upload their statements and view statements and interact with Social Security. And the portal that we're focusing on today, which is the healthcare provider portal, which will allow you to submit medical certificates for your patients and also view those transactions. Every medical certificate you've submitted, you'll be able to view on the portal, and some other key services that would help you to provide better service with respect to Social Security on your portal. So that's a brief overview. I know it was very quick, but we'll be available here for questions later on. So thank you very much. Have a good day.
Thank you so much, Mr. McGregor, for that brief presentation just now. Now I'd like to welcome Mr. Justin Gittens, the Technical Solutions Manager for Davin, who will be walking you through the features of the healthcare services aspect of our My Social Security portal.
My name is Justin Gittens. I work with Davin and we work alongside the Social Security Board Belize to implement this project. So happy to be here with you guys today. We have a short demonstration this evening, and these are the things we want to cover. First, I'll just give a real quick process overview with a context and then description, and then we'll jump into our demonstration, and then we'll have some Q&A. So this slide looks a bit much, but really what I want to indicate here is that what we'll be looking at this evening is part of a larger process. Just below here, you see we have doctors, IPs, insured persons, and we have S.S.B back office users, employers, etc. But we're really focusing today on this first step on the health provider portal, which really comprises these four things that we want to have happen. This first block is what we'll be concentrating on, where you, the medical practitioners, will be submitting medical certificates. There are different types of certificates, but we're focusing today on sickness benefit medical certificates, right? And I'll also demonstrate where the IP will pick up from there and submit their claim. The employer has some declarations they need to do, and then claim processing. Right, so just to drill in, focusing on what the medical certificate process is, we'll start with having a look at accessing the portal. Everyone that is a medical provider authorized to do work with the Social Security Board will receive an invitation, whether or not you already have a My Social Security account. Right, so you get that invitation and you will log in. So we'll have a look at that in our demonstration. And then we'll go through the steps to create that certificate. It's very simple. I'll show you how easy that is. You confirm the IP's details, you enter the incapacitation dates, you choose, you enter the diagnosis. You may have a primary and a secondary, or just one. And then you confirm some details on the certification and submit. So those are the steps we're going to be following today. I hope the demonstration will be there about 25 minutes. And we're going to follow these steps again. I just have noted. Yeah, so let's jump right into it. Okay, so I went ahead and I sent an invitation to a fictitious practitioner called Ward. Ward Medica is his name. Ward, forgive me, but I used your first name. And what we're going to do right now is go to Ward's email inbox. And his address is Dr. Ward. So this here simulates an email inbox, and I've sent the email to this address. So you can see here that I sent this 11 minutes ago when the meeting started. So by that, you know it's a brand new invitation. This person has never logged in before. And what you see on screen, forget all of this stuff at the top. This is just simulating when the email was sent. But you see the body of the invitation you will receive. So it just says there, medical practitioner, we're pleased to inform you you've been registered. You need to log in within 30 days. Click here to visit the portal. You'll also have some login information at the bottom there. So once you click this link, it will take you over to the portal. And this is already logged in with another account. So you'll click login. And here you will have the option to enter a username and password. So this person's username is drward@mailinator. So I'm going to enter that. Great. And their password, I'll grab here. So we've entered the password, and this should now land us with a brand new account on the portal itself. Great. So we see, if you're seeing this for the first time, I'll just take a brief moment to explain this interface. But this is the My Social Security portal. And this caters to several groupings or personas, several types of people will use this portal. IPs, insured persons, they already use a version of this portal. We also have employers. They come onto this portal to submit statements and look at the information on their account with Social Security. But what we're looking forward to next is having our medical practitioners participate, and that's what this is all about. So right at the top left here, you can see an area where you can access as different accounts. And with this account, I only have one because we just invited Dr. Ward Medica, and this is the only account that we have access to at the moment. So all of these other sections will be blank because we don't have those profiles enabled on this account. Great. So what I will go to next is medical certificates. This is the area that you'd be working from to submit and view your existing medical certificates. So the first thing we covered was having an invitation. So we saw the invitation came in via email. We clicked on the link to go to the portal. We used the provided username and password, and we got access to our account. So the next step now is initiating the process of submitting the medical certificate, which starts with this green button, Add Medical Certificate. So I'm going to click on there, and we have a very short form. They have 3 steps up here. First, we're going to confirm the details of the insured person that is sitting in front of us for this medical encounter. So most likely you may have this information, or you just ask them for their SSN. So I'm going to pull up the SSN for this person now. What I will demonstrate here is entering, of course, this is not real data, but you will need the Social Security number of the person you're seeing. So this is their SSN, and now we enter their first and surname, as well as their date of birth. So this is the 1994. And we're looking for September and the 1st. But I'm going to deliberately choose the 2nd of September to demonstrate that we have validation on this field, on this form, that will not allow you to enter the wrong information for this insured person. So I entered their incorrect date of birth. Even if I enter their wrong Social Security number and I try to advance, it's going to let us know that, hey, that's not correct. So you're going to need correct information for this IP. And once you have that, like you just saw, it will advance us to the next step of the process, which is entering the diagnosis. So during the medical encounter, you saw the patient and you assessed them. And at this point, you have to enter the primary diagnosis that you came up with. These here are a list of ICD codes, which you would be more familiar with it than I am. But you typically search this. You can search by the code, or you can search by the terms. I'm searching here for example, a headache. And these lists of codes should be familiar to you guys. If you also have another diagnosis, you can enter that for a secondary diagnosis, but this is not at all required. It's optional. As a matter of fact, I'll leave it out in filling this out. The other thing that we need to do is enter the period of incapacitation. So the period that you're giving this person sick leave for. And so I'll select the day, the 1st to the 4th. And now we have to declare that this person is fit to return to work after the period of incapacity. And any comments? I also want to demonstrate here that if the period of incapacity is before the date of examination. In other words, you're examining the person today, but you're giving a period of incapacity that starts prior to the current date. Then you're going to have to enter a reason for backdating this medical certificate. Okay, so this will become required should that be the case. But for now, I'll put this back so we don't need to enter that. And hit next section. And this is the last section that you need to fill, which really is a review. So this is the medical council reg number that Dr. Ward has. This is the institution he's working out of currently. Well, by default, we will set up these institutions. However, there's a list of institutions here. And if you're working out of a different institution at that point in time, you simply need to select a different one. And the address for that institution as it is populated in the system will appear accordingly. Right, so I went back to medical associates, and the next section will simply be a summary of the information we just gave. And this is the patient's name, the date of examination, the diagnosis, the period of incapacity, any comments that we left. And the last step is for us to give our consent to these declarations. I agree to use this form of electronic signing, and I understand that it's an offense to provide false or misleading information. And that's the end of the certificate process. We give this confirmation just at the end of submitting. And if I go back to the emails, let's go back to the inbox. You will see immediately this just came in, a confirmation that you would have just stating that the certificate was successfully submitted. Great. So that really is the first part we want to focus on. I hope that was clear and simple enough. At the end of it, you will have a list of all of the medical certificates you submitted over the course of your practice. So you can click here on view, and you will see that same summary we showed at the end. We bring this view back to you for easy reference. Great. So that's the main focus of this demonstration. We wanted to ensure that you were aware of the upcoming feature. So this part of the portal, which is catering to our medical practitioners, the ability for you to create a medical certificate, and the ability for you to fill out that information and review it at the end. I also forgot to mention that you can start this medical certificate and it will be in draft mode, and you will be able to come back to it at a later date and finish it off to submit at your convenience. All right, so instead of submission status being submitted, you will see this being in draft mode. Okay, so the other thing I want to show, if I go back to this slide, what we saw was the invitation process. We saw the submission of the medical certificate, and we want to also give you some awareness of what the IP has to do and also the employer at the end. So I'll take just a short moment to show you these parts of the process as well. So for that, I will now log out of this account and log in with a different account. So I'm going to log out here. And I'm going to now log in with another account I have prepared. And we submitted that medical certificate for an insured person called Carlos Saints. So this account has multiple profiles, as you can see here. And I want to look for Mr. Saints. So Carlos Saints has his portal all set up. And in the benefits section, he's able to go to My Claims. And at this point, he sees that he has several claims in an incomplete state. The one that we're focusing on is this one here. This was the last one that was submitted. So he'll go ahead and click edit on there. And this just gives him basic information on the requirements to submit this claim. So there's an age requirement, and he also needs to have updated banking information. But this form here is prepared, comes pre-populated with information that we already have on Carlos, like his date of birth, his address. So all he needs to do is review those things and confirm that, yes, this is in fact true. And he clicks this button here to confirm that he can be contacted by the above information. This other question, are you currently employed? We need to know who Carlos is employed with. And we have a sense of who he's already employed with because the system is integrated. So he says yes. And all he has to do is click add employment record. And we pre-populate who he's employed with because we have a record based on the contributions that were submitted for him in the past. So we see that he is, or his last employer was Belize Software Development Limited, but we're asking him here to confirm that this is his current employer. And we're also asking him to give the start date for when he began working with this company. So that was some time ago. I'm going to say the 4th of April, 2011. And he saves and adds a record. So we have this here. The other part is just reviewing his banking information. If this is not correct, there will be an option for him to correct that. And at this point, we pre-populated the claim details, the dates that he's requesting sickness benefit for. These came from the medical cert that the medical providers entered. But of course, he can ask for any claim period that he desires. So I just changed it from the 31st instead of the 1st to the 4th. And he just has to give agreement to these declarations and submit. He'll also receive email confirmation at the end. And he could return to the benefits page. If he goes to the claim, he will see that it's now submitted. I could go over to his email. And we could have a look at the email addresses that we had triggered. So this now goes to the employer because the IP just submitted, and this leads us to the next step in our demonstration block. So the IP just submits their claim, and now we want the employer to submit just some basic information to help us be able to process that claim according to the rules and the legislation that's in force. All right, so the employer will get a notice saying that this is not the right one, but 1 minute ago. Right, so they Belize Software, that's the employer's name. This claim for Carlos has been submitted. Please click here to review and action it. Right, and the IP also gets a confirmation that they submitted the claim, just like I showed for the health provider. It's a very similar email. So let's go back here. This is the IP's view. They can also see on the portal that their claim has been submitted. But now let's switch to the employer that I already have configured here. So for the employer, on their dashboard, they will now see a request. The description of this request here is a sickness claim. And it's in the new status, and we're going to ask them to review it. So on clicking that, they will just see basic information. So this was submitted by Carlos. We assume that Carlos works for them. They will have to confirm that and tell us the last day that Carlos worked. before that, we could see the period that Carlos is claiming for. These are the dates that we entered in the sickness benefit claim form, the 31st to the 4th. And all the employee needs to do at this point is confirm the last day and time that Carlos worked. So we will put here that Carlos, he worked on the 1st, and he left work at 3 p.m., 3:38 p.m. And yes, he's still currently employed with the company. Just certify that this information is true, and we submit this form. If Carlos did not have all of the contributions required for processing this claim, and we required that information from his company, Belize Software Development Limited, we will also post that question here. But it seems like Carlos does have the required contributions, so we're not asking the employer about that in this section, right? So all that they need to do now is to submit, and that's the end of the process. So at this point, S.S.B. in their back office, they would have some notifications, they would have a listing of claims, and some claims may be automatically processed. Some claims may need review, but there's logic and functionality to have all of those claims processed in the shortest space of time. So I'd like to thank you for your time. That brings me to the end of the demonstration where we looked at the invitation process. We looked at the medical provider's ability to submit a medical certificate. Right now, it's just for sickness, but there will be others in the future. We looked at the IP's ability to view the claim and to submit it. And we looked just briefly at the employer's role in this process, which is submitting a declaration that this IP still works for them, etc. So that's all we have today. Now it's time for Q&A, and I'd like to pass it back over to Vanessa.
Thank you so much, Mr. Gittens. The floor is now open for questions. I just want to remind you that you can use the raise hand feature if you have a question. And of course, you can also post your questions in the chat. S.S.B managers, I'd just like to remind you that you can post your questions in the Let's Talk Peranza on Viva Engage. So I believe we do have some questions in the chat, and we have a qualified team who is here who can answer your questions. So let us begin. Oh, in addition to that, I'd also like to say that I have posted the very short survey that I had mentioned in the beginning. It's very short, and I'm posting it once again. It's just to confirm your contact information and just one or two other questions. So it really will not take a lot of time for you to answer the questions and submit. So let's start with the first question that we see here. What if entering the SS number, Social Security number, will populate the patient demographic information? The floor is open.
That is not a feature of the portal. So the only information that is returned to the user, to the medical provider when they enter the Social Security number, is the information that they need to process the medical certificate, and information that's needed actually by Social Security on the medical certificate. So it doesn't pull up any unneeded demographic information.
Okay. I see a question here from, I would say, Dr. Ramon Yakab.
Yes, hi, good evening. Following up with the question about the demographics, I'm seeing there that the Social Security number is required, but then I saw Mr. Gittens writing the name and the surname. Wouldn't it be easier if if Social Security already has the patient's information for us just to input the number and the name and surname and date of birth to appear automatically?
Thanks for that question. Dr. Jakob, the reason why we don't return information based on just a social security number is for the privacy and security of the patient themselves, right? We don't want it's an effort to prevent fraud, right? So if the person needs to know their social security number and obviously their first name, last name, and date of birth, if they don't know all that information, then the request can be suspicious, right? So that's why we don't pull back information from Social Security. We use that information that we have to verify that patient that's in front of you is indeed who they say they are.
Additionally, if I may add, Dr. Jakob, if you only enter the SSN, then there's a chance you could enter someone else's SSN. For instance, if you only enter the SSN without entering the first and last name and date of birth, you could be entering somebody else's information, and we only pick that up after the fact. So that's why we attempt to validate that at the very start.
Mr. Jitens, it was in relation, for example, when we're using apps on the day-to-day basis, I mean, if we have a identification number, in this case, the S.S.B number, and I have a patient coming into me today, and we issue the claim, if I have the patient's social security in front of me, the patient in front of me, I think it will be more user-friendly if we input the number and automatically in the screen, the name and surname would appear. That was my thought.
Oh.
So we would be seeing the patient, we would be seeing his card, and at the same time, it would be user-friendly for us. The reason I'm saying is because a lot of colleagues, we're seeing more than one patient a day. We're seeing a number of patients. And if a number of patients come in for sick leave or may require a sick leave, then inputting the surname, the name, the date of birth every single time may also put a strain on us as physicians on already the work that we're doing.
Yeah, and I appreciate that comment. Part of the reason we took this approach is if we allowed you to simply enter the SSN only, and then we show you based on that input, that person's first name and surname and date of birth, then you can enter any random SSNs in there and find out other insured persons' personal details. So that's in an attempt to prevent that type of phishing expedition by bad actors.
Can I?
Thank you.
Hello?
Go ahead,
we
Dr.
ask-
An.
Go ahead.
Go ahead. You're talking about me, Dr. Marenco, no? I am the one who suggested the population of the demographic on the patient. Precisely, we were talking about, name and date of birth, and that will be, as Dr. Jakob mentioned, making the system by far user-friendly. If we are talking about misbehaving and doing things like that, I believe that there must be a level of responsibility that we as physicians have, ensuring that when we submit this, we are talking about a particular patient that is in front of us, that we know that we have the Social Security identification in front of us.
S.S.B with John, our small place,
So,
Sasa.
Dr. Jose, is it? We understand and appreciate that.
Marenco.
Yes, we understand and appreciate that, but we do have a responsibility from the Social Security Act of Belize and also the Privacy Act of Belize to provide that kind of security for patients and for patients' information, right? We understand in good faith, yeah, but we have to always err on the side of the patient and the IP, because if a system is compromised, then that's a big wide open door into our system to get IP's information. So we understand the difficulty here, but we really do have to err on the side of the IPs and their information and keeping it safe.
Can I just suggest something? No, it's just a matter of the date of birth and the real name of the person and the social security. We are not talking about every other personal information of the person.
Dr. Jose,
Uh,
if Belize continues in the trend that it's in, with the government's use of implementation of national ID, where a national ID is now tied to your credit information at bank. All I need to be a bad actor is to be able to get your date of birth, your social security number, and your first and last name, and I have access to everything. So we understand this, but as a foundational repository for citizen data in Belize, we have to err at the on caution with respect to the IP.
I'll have to take it from you, but I believe there must be some way of in the information technology that you can limit that and protect the patient
This is
information. But anyway, I understand. Thank you very much.
You're welcome.
I think I saw Mr. Wade's hand up. Mr. Wade?
No, thanks. I hit the
Oh.
wrong button.
Okay. Dr. Williams, I think then. Dr. Randa? Dr. Randa Williams, were you going to make a comment? You can mute your mic, Mr. Wade. Your mic is not muted. Yeah.
Muted?
Muted. Mute your mic.
All right. Not sure how you do that, but I'll.
You. Dr. Randa, you had a comment? Someone else had a comment? Not seeing there. Any other questions? Or your view and your perspective is welcome. Dr. Perez, Johan Perez.
Yes, good night.
Good night, Doc.
Thank you for this great presentation and to bring this entire system to modernity. It's really good to see. I just had a question in terms of the I noted that there was a list of healthcare institutions where a doctor can put where he's affiliated with. But what happens if for some reason a clinician is not affiliated with one of those clinics? Can we enter?
He has the option, I think, to enter his private clinic, his private clinic. He might be from his private clinic. Right? Is that what you're referring to?
Yes.
Okay. Mm-hmm. You may have a private consultation, so he will have the option to select his private consultation office.
So actually, are you navigating Justin?
Yeah, sorry, I'm trying to get to that spot.
Okay. Yeah,
okay.
Kids. No, so that's a good catch, Doc, because what we usually do in those circumstances is we give you a checkbox that says you don't see your clinic, right? And we allow you to fill in the details of that clinic by freehand, and then we go research it. We probably call you to verify the address and everything, the particulars of that clinic, to then add to our database. So that's I didn't see that there, so that's something we need to add.
Okay, noted.
Okay, so we see some more questions, more raised hands. Let us continue. We
Dr.
have-
Renee?
Mhm.
Hi, I was just going to say, I've had some patients tell me that they did their claim online and then they didn't hear anything. And so then they went in with a physical copy because they're saying when they went in, they were told, well, we have to do all the physical copies now, and then we don't have time to look on the online ones. I would like to be able to have something to say to them, to say, well, actually, no, it really is being looked at. So can you give me what would be a good response to the patients that say that?
A good response will be to contact our customer service representative or unit so that we can find out exactly what occurred. Because there is provision currently to submit your sickness benefit claim online. It's not fully end-to-end process. It just allows for the submission of the claim online, attaching the medical certificate and the salary records if applicable, and that it's submitted. Once it's submitted to, they receive a confirmation of receipt, and through email, through the email provided, we communicate with them. So if she's having any problem, she needs to contact our customer services unit so that we can follow up and resolve and whatever issue she's having.
Wonderful. So what I'm hearing you say is that if they don't get a confirmation, maybe they didn't fill it in correctly.
Correctly, because once they click submit, they should get a confirmation of submission.
Wonderful. That's exactly what I need to know.
And
Thank you.
and if they didn't get if they did it and it didn't get a confirmation, they need to contact us so that we attempt to resolve whatever issue there is.
Perfect. That's what I need to know. Thank you.
You're welcome.
Okay, so thank you very much for that question. We want to address some of those questions that have been populating our chat of late. So the first question I see there is Dr. Jesus Ken. It says, was a little late joining the invitation process or the issuing of the certificates is through the same S.S.B portal we have been asked to join. So that's a question coming from Dr. Jesus Ken.
Well, I don't understand. Could you slow down? Because it sounded like a statement. So
it says here, was a little late joining. The invitation process or the issuing of certificates is through the same S.S.B portal. So they're asking if it's the same place that they would deal with the certificates.
yeah, so so if you already have signed up for an S.S.B portal account, you won't have to get the new login information because you already have access to the portal. What the invitation will do will allow you access to the medical provider portal. As you saw, Mr. Gittens demonstrated, there are several ways, as he's showing right now, there are several profiles, if you will, that a user can have, a user of the portal can have. A user can be just a regular insured person, which means that they will access the portal to view and manage their own information with Social Security, or people that are dependent on them. That's that first section right there. The second way they can use the portal is as an employer. So if they have a business, if you have your own private clinic and you have employees that work for you, or you have domestics at home or whatever, you're an employer, you can access, and you manages your business's account in terms of submitting statements and so on. You can access as an employer. And finally, you can access as the medical provider, which is that last piece on the bottom, as you know, and that will give you the dashboard, give you access to everything that you do with respect to submitting medical certificates, right? So yes, now the invitation for the medicals, this portal, the medical portal, providers portal, our healthcare providers portal, as we call it, will be sent to you whenever this is all rolled out, right? So don't expect to be able right now at this moment to be able to go in and see medical provider as an option to get in, because you will know, you will get an invitation from Social Security and email to you as long as you've given us your credentials. I think that's why that survey is there, so that we can have your actual credentials, the right email addresses, and so on and so forth. And then we'll be sending you an invitation that will allow you then to access in the profile of a medical provider, right? So, but that's not available to you right now. This session is to get you familiar with it, so that when you get that email, you know exactly what to do with it, right? So that's where we are right now.
Okay, so another question here says, can the picture of the IP be added to the healthcare provider platform as an added layer of security for IPs?
That's a good suggestion,
That's a
Justin.
good suggestion indeed. Mhm.
Yeah, we do store the picture of the IPs, so I think that's a good suggestion. Yeah, we could have that in.
So I guess, Justin, when it returns, when it does that check, it then populates the picture.
Yeah,
somewhere.
so when this validates,
Yeah.
we could have a little box somewhere that pops up the picture of the IP for added confirmation.
Okay, so we also have another question here by Dr. Francis Moray. He says, how does the medical practitioner get set up in terms of his or her account and get an invitation for the portal?
So that would be a function of internal S.S.B, right? Marie, you would have a list of all of the medical practitioners, and we will issue invitations internally. There's a process by which we upload the invitations, and they get sent via email. So you'd have to check the email. Once you have provided S.S.B a valid email address, you will receive an email invitation like we showed, with username and password if you don't already have an account, and you can sign up, change your password, and access the portal like you see on screen.
I think what you didn't show, Justin, is how do you create a portal login? There are some doctors that have created a portal login, but there are some doctors here that may have not created a portal login, and thus they are not aware. What's the process to create a portal login? As it's one portal, just to be clear, it's one portal. When you go in to the when you create your portal login, you will be able to see your information as an insured person, registered with the Social Security Board. And when the healthcare feature is ready, you'll be getting an invitation so that you can see the feature on this same portal. So it's one portal, but currently you're unable to see the feature. Once it's deployed, it will be an invitation will be sent to you so that you are able to see the feature on the same My Social Security portal, just to be clear.
Okay. Just let me clarify that, please. So as I said earlier, there are different profiles you can use in accessing the portal, right? Right now, there are two profiles that are being used, either as an IP, an insured person, which gives you access to your personal information at Social Security Board, or as an employer. And then as an employer, it gives you access to your employer information if you're the one that submits statements and so on. It is quite possible for the bigger institutions to have the person in HR that manages payroll to have access to that particular employer portal, right? So now So now whenever you get that invitation from us to use the medical provider portal, you will be able to use that profile as a medical provider to submit medical certificates and view the history of medical certificates you've submitted. So there are 3 profiles so far. There are 3 profiles that will be available to you on the portal. 1 login, 1 credential gives you access to the different profiles.
Yes. Please go ahead, Justin, and show how you create the login to join the My Social Security portal.
Okay, so I'm not sure if everyone was looking at my screen, but there was a link to sign up now or to create an account. I clicked that and it took me to this page with basic information. So your date of birth, your phone number, which I did not enter. You have to enter the email address and you will receive a code at that email address that helps us ensure that it's valid. The confirmation will look like this to validate your.
Use your personal email.
Yeah, you can use your
work email.
Yep. And once you enter that information, you choose a password, you enter your first and surname, and you can also select a reason here to access the healthcare portal, because someone at S.S.B will be monitoring all the signups that pertain to the healthcare portal. So this allows us to triage the requests that come in. And once we receive this, somebody will be able to quickly action it. But clicking create here will send that request to S.S.B. But you'll immediately have a portal account. It will initialize like you're seeing here. And it won't be active until S.S.B approves it on the back end. Okay, but that's the process.
Okay, at this time, I'd very much like to acknowledge Dr. Yakab and also Dr. Renee. They've had their hands up, using the hand icon for a bit, and I just want to acknowledge them and give them the opportunity to ask their questions.
Yes, in terms of the time now, when we're giving the sick leave, is the app in itself or the portal itself going to give us a limit of time that we can extend the sick leave to patients? Now, the reason I'm saying this is because, well, I deal with cancer patients, and a lot of them are patients who have terminal stage. So is there going to be like a time limit that we can extend for these patients there? Or is it on my criteria that if I know the patient may die in 3 months, to give 3 months of sick leave?
The days of incapacity that are to be prescribed by you, it's based on your evaluation and criteria and diagnosis of the patient. And if it's coming from, if we need the further evidence to justify the incapacity that you have provided, we will request it from the insured person. And in any given case, but you as a specialist, in a case of a terminally ill, you can certify the capacity that in your view, it's justified for that patient, bearing in mind the diagnosis. And bearing in mind, of course, that the maximum on the sick leave that Social Security pays for in any sick leave is 234 days.
And Ms. Chamaria, going back to that question now, since it is on my judgment, I do know that if the patient is unable to go and work again, they file for invalidity. Considering now that we're going to input the information electronically, can a patient file in for invalidity instead of waiting for the sick leave to end, considering that at the end of the day, they will pass away from this?
To qualify for invalidity benefit, provisions will be made, but invalidity benefit is an upcoming invalidity benefit. For any patient to qualify for sick for invalidity benefit, they must have been sick for at least 26 weeks before they can claim invalidity. So the You can certify incapacity up to 26 weeks, and after the 26 weeks have elapsed, they have the right to make an invalidity claim.
And that's where the question would come in. And I'm taking the forum for this. So if the patient doesn't, the prognosis in itself is less than 26 weeks, how would this patient qualify for invalidity?
I have to check save you. I don't know if I could find your nipple. Can I ask a special nipple?
Excuse me, someone mic is not muted and we're hearing about some nipples. Yes, sorry, doc. Please,
Yes.
Please repeat.
Yes, no, my question was then if any patient, I mean, considering the prognosis, they may not qualify for 26 weeks because they may die before that time. How can we proceed with them? Because it's a question I generally get when I'm extending them the sick leave. And I know the patient is going to die and they may not be able to get 26 weeks of sick leave. How do we go through that? I mean, seeing the benefit for the patient, if they have benefits then.
They would benefit from sick leave for sick leave up to the time of death, and after the time of death, the survivors would have the right to make a survivor's claim in relation to their to the death of the insured person.
Okay. Thank you.
Yeah, and that is why it is very important. Early diagnosis is also very important to ensure that they get the days of incapacity they are entitled for whatever illness they have before they may die due to the terminal diagnosis. So they can benefit. And when the benefit paid on a sickness benefit is usually higher than the invalidity benefit, so you would want them to claim for the sickness benefit to ensure that they get the maximum benefit paid.
Thank you, Shari. That clears a lot.
I just want to take this opportunity to let you all know that I had revised the link for the survey, and anyone should be able to open it and answer those questions. There shouldn't be any issue opening that particular survey. I've also put the QR code as well for those of you who would like to access the survey that way. Looking at the questions posed that we haven't had a chance to answer yet in the chat, one of the questions coming from Anne and Leonel Sirai. I'm not sure if I'm pronouncing that. Sinai? Is that Sinai? Sorry. It says the portal for the employer can be used. Okay, I'm not understanding that particular question, but we can move forward. There are some more questions up top. Just let's go back up top to some of those that we didn't catch. Okay. I did see a question there from Lesbia Guerra Kokom. How will medical certificates issued by doctors certifying outside of the country be managed online? That's the first part of that question. And secondly, currently as a GP, I stamped the foreign doctor's medical certificate and in the comment section specify that I am not the treating physician. That is the question.
We are still, we cannot honor any medical certificates that come from abroad. So we have to rely on our local physicians to conduct an evaluation, look at the case and certify the period of incapacity required. Once it's countersigned, then we accept those claims. So it would have to remain the same way. We will have to look at that as how we are going to be handling the medical certificates from abroad. But for now, a certificate must be signed by a registered medical practitioner legally practicing in Belize.
Okay. Here's another question. For an extension of sick days, a medical officer would require to submit a next online medical certificate, or can the previous submitted medical certificate be modified?
Please repeat the question, Vanessa.
The person stated for an extension of sick days, a medical officer would require, I guess, you to submit a next online medical certificate, question mark, or can the previous submitted medical certificate be modified? That comes from Dr. Roger Keme, if I'm not sure if I'm pronouncing the last name correctly.
I'm not sure if I'm understanding the question well, but let me try and answer the question. If you submit a claim, once the claim is submitted, that claim has been submitted, you will be unable to modify that claim because that medical certificate has been submitted. You will have to do a new claim to certify any further incapacity. The only time you'll be able to modify if you have the medical certificate in draft and you modify and submit.
Okay. Here's a question coming from Dr. Gonzalez. When will this be implemented? Meaning what we're talking about this evening.
Well, it's currently being tested, and once part of the reason we're doing this session is to get your feedback on improvements that we could make and to increase your adoption when it actually gets live. So we still have a number of steps to do, but we're going to deploy this as soon as we can.
Okay, thank you, Mr. Gittens. Another question here for the MO. What if the medical institution is not in the options?
We have the option at the back end to enter any other newly identified medical institution. We would have to make provision for them to indicate if there is a new institution.
Well, that's just as a question we had earlier, right? We have to add a feature to the portal. So when you go and look for your medical institution, if you don't find it, there would be a radar button that you click saying I don't see my medical institution. Give you the opportunity to put the name and address and I guess what all the other details for that medical information there. The process is internally Social Security will vet that information, which means they'll call you to review and ensure that that information is indeed accurate. And then we will add that to our database. And so the next time you go on to view, to do a medical certificate, you would find your institution in the list.
Yes, and part of verification would be, or validation would be checking with the Ministry of Health if it's a licensed medical institution.
Thank you, Mrs. Chavaria and Mr. McGregor. Next question here. What is the correct URL to bookmark the portal on the browser? And the next part of that is also to ensure the URL is safe and not a malicious link. Are there any tips available?
Well, I've never had a response from a browser saying the link that we have for or portal is a malicious link. But if that's the case, please contact Social Security as soon as possible. Justin, can you show the Social Security that org.bz link if you can? Yeah. So on here, once this portal is, so you have the My Social Security portal. That's where you would go to access all the portals. And you have that login page, and that's the page that you would use. You can bookmark that on your that particular page on your browser, but that's where you go to log into the Social Security org that the My Social Security portal.
Yeah, if they were getting confused by this URL, this is just one of our development environments that we're using here. So the URL will not look anything near as confusing as this is.
Yeah, no, this is our environment that we have right now. But yeah, that's the official URL for the portal. And as we said, there's different profiles through that URL that will enable you to get to either your personal information, employer information, or when it's deployed, when you get your invitation, the medical provider's information.
Okay, thank you. There's one more question here that I'm seeing. Will this system go completely electronic? Asking because there are clinics that don't have computer access, and in brackets, meaning that they are still using paper documentation.
Well, yeah, so there's going to be a transition period. We will evaluate each clinic as we understand their situation. Obviously, during the transition period, we would be able to accept from the insured person paper. So they would be able to, I guess, come into the office as usual at Social Security, which means they would have to bring the paper version of the medical certificate from you, the medical provider. They would also have to go to the employer and get their SM2, as we call it, their salary record and confirmation of employment from them, from the employer, and bring both those things along with their filled in form to the office to have that entered into the system to create that claim. Now, eventually, when they get into Social Security offices, and whenever we start deploying kiosks at those offices, they would be able to walk into the office, go to one of the computer kiosks, and then enter that information, upload, if you will, the medical, the provider certificate, but also they would have to type in the information because we want to ensure that the information we collect is accurate and correct. But they will be able to create that claim, make that claim on a computer at the Social Security office. That's not right now, but whenever we deploy kiosks in the branches, that would be possible. Obviously, with that, for people that are not computer savvy, they would be able to be guided by customer service agents that would be able to give them assistance in filling out those claim forms. But right now, we definitely allow for paper during the transition period. And as we evaluate the clinics that are in most of the rural areas that don't have access to internet and so on and so forth, we obviously will, but those people would have to come into whatever their main branch is and submit that claim with all necessary information.
Okay, thank you. We'll be answering one last question at this time. The last question here I see from Dr. Jennifer is that, will there be a need for electronic signatures when issuing the medical certificate? Or I should reword that and say, based off of the demo, she didn't see where you would put in an electronic signature. So she's wondering if we will require that feature or not.
Well, the feature isn't required right now, but again, we are relying on the medical practitioner because by law the medical certificate must be submitted by a medical doctor, right, Marie? Can't be your secretary or anything.
No.
But we have disclosures on that form as we see it there, that by doing these things legally, you're acknowledging that you, the doctor, are the ones submitting this medical certificate. And if it comes to light that it's not the case, then, the second disclaimer warns of what the penalty can be. And that's actually in the laws.
Okay.
And the credentials that we are using is your practicing or registration number from received from the medical council that will be validating your name with your registration number at the back end.
Thank you so much. At this time, we would like to close. I thank you once again for choosing to spend your Wednesday evening with us to discuss the enhancements to the My Social Security Self-Service Portal. And if you have further queries, and if there was any question that was asked that somehow we didn't get to, I want you to know that we will be compiling those questions and we'll address them and send the answers to the Belize Medical Dental Association tomorrow. So I just want you to know that we will make sure that we have covered every single question. And of course, this webinar is being recorded and eventually we will share it with you as well. So in addition to that, if you have any other questions that you would like to ask, please remember that we have a customer care center and the number is 639-5745. Repeat the number again, 639-5745. In addition, whenever we have updates, we will send you emails. We will post information on our Facebook page. For those of you who are into, the other types of social media, which would be TikTok and Instagram. Yes, indeed, we are on those apps as well. And then from time to time, we would also send radio mentions to Creme and Love radio/TV to get the word out for whatever we're doing. So we have various ways that you can stay in step with us. I would also at this time like to encourage you, if you did not click on the link or use the QR code to filling out the survey questions. As I said before, it is it's a very short survey and it will help us to make sure we have accurate contact information for you and also to take into account whatever feedback you might have based off of the webinar that you have participated in so far. So once again, thank you so very much for tuning in, logging in this evening and giving us your time. And I'd also like to thank the presenters, Mr. Ward McGregor, Mrs. Maricha Maria, Mr. Justin Gittens. Thank you so much for your presentations made this evening. And indeed, I'd like to say safe travel for everyone. I don't know where you're tuning in to be a part of this webinar, but safe travels, and we hope to connect with you soon again. Thank you.